Welcome to the IC101 Masterclass. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm also the longest serving IC support group leader here in the United States at 30 years and counting. My purpose in designing this class is to help you, the newly diagnosed patient, or you, the grizzled IC veteran, understand where we are with IC today, because a lot of what we learned 10, 15, 20 years ago has been replaced. So in this series of small videos, you're going to learn more about what IC is, how it's diagnosed, what our phenotypes or subtypes are, the best, most effective treatments, how to manage diet, how to manage other self-help strategies, pelvic floor dysfunction, you name it, we're going to talk about it. And so I hope truly that you find this course useful. And as always, if you have any questions, you're welcome to reach out to me directly through the IC Network website. If you see that right there, it's icnetwork.org. Now let's get started. So what is interstitial cystitis, or bladder pain syndrome, or hypersensitive bladder syndrome, or chronic pelvic pain syndrome? Basically, these are all diagnoses that have been applied to patients who struggle with urinary frequency, urgency, pressure, pain, especially pain as the bladder fills with urine that is relieved by urination, although quite a few of you, myself included, have pain after they're done urinating. Now, these are all symptoms that you would associate with your bladder, and especially a urinary tract infection. And yet, for many of us, our bladder is normal and/or they don't find any sign of a bladder infection. So what is this? Well, for many years, we thought IC was an incurable bladder disease. And yet today, that's really changed. And in fact, if you look at our latest national guidelines, they're very blunt. A disease process is not normally found in the bladder wall of most IC patients. Rather, today we look at IC as a neuromuscular disorder, that there is a problem with nerves and/or pelvic floor muscles that are directly affecting the bladder and causing these symptoms. Now, if you were to come to one of my IC support group meetings, one of the things that you would see very quickly is the diversity. For some of us, IC begins in childhood, myself included. For others, IC begins after menopause. We have the same diagnosis, but are we really the same? No, we're not. For some people, IC begins after going through chemotherapy or because they have a terrible diet and they're drinking a massive amount of soda. While for others, IC begins after having a baby or falling on their tailbone. Are they the same? Absolutely not. And so today we recognize that that old approach of giving patients a bladder treatment, giving patients an antidepressant in the diet, and sending them on their way for 6 months is ineffective. So what we're doing now is a much more individualized diagnostic workup so that we can solve the mystery of your pain. Rather than chasing the symptoms with treatments, we have to be laser focused on trying to understand underlying causation. We want to treat the cause so that you don't have the symptoms. So let me give you a really good example of that. Some patients have described a feeling of heaviness, like they're carrying a bowling ball around in their pelvis. As the day goes on, this heaviness gets worse and worse and worse, until by the end of the day, they can barely walk. What is that? Now, of course, they're having urinary symptoms, so they're thinking it's UTI, but actually, that's a symptom of something called pelvic congestion syndrome. That's the equivalent of varicose veins in your pelvis. The blood is pooling in your pelvis as the day goes on, and it's getting heavier and heavier. Thankfully, it's very treatable. So you are an anatomical mystery to be solved. And in our next video, we're going to talk about diagnostic methods, and then we'll be talking about phenotypes. So hang tight.